Going to discuss the intersection of socioeconomic status, race, and healthcare access within Mississippi specifically, and the role that Medicaid expansion, or in this case, not having Medicaid expansion, plays on one's access to healthcare. Mississippi, like many states in the U.S., often faces disparities in healthcare access, particularly among low income communities and people of color. These inequalities have been shown by the state's refusal to expand Medicaid under the Affordable Care Act, thus leaving many without the coverage they need to succeed in terms of their health. Medicaid is essential for low income populations, especially being Black, Latino, and rural communities within Mississippi. Research has shown that these groups are more likely to live below the federal poverty line, where access to affordable health care is often limited. However, in Mississippi, the decision not to expand Medicaid has had devastating effects, specifically on Mississippi and other rural states. Research shows that without Medicaid expansion, many residents are forced to make choices between paying for health care or meeting basic needs such as food, housing, and utilities. This issue is particularly pronounced in Mississippi's rural areas, where healthcare facilities are already seen as scarce. Residents in these regions often have to travel long distances to receive care, leading to delays in treatment and ultimately worse health outcomes. The Mississippi State Department of Health highlights that the state's refusal to expand Medicaid deepens health disparities. Low-income populations, particularly in these rural areas, experience significant barriers to accessing healthcare services, which thus also results in poor health outcomes. Medicaid expansion could alleviate some of these barriers by providing access to care for marginalized populations that are currently excluded from the system. In addition to this, socioeconomic status is one of the key factors that shape healthcare access and outcomes. For low income individuals, the lack of Medicaid coverage means that even basic healthcare services may seem out of reach for some individuals. In Mississippi, these disparities are even more pronounced for people of color. Studies show that people of color, particularly the Black and Latino populations in these rural areas, are less likely to have employer sponsored insurance or access to affordable health care. As a result, they often face worse health outcomes and higher mortality rates compared to white counterparts. This is directly tied to socioeconomic status and the state's political decision to reject Medicaid expansion. Research has shown that Black families, for example, have only about 1/20th of the wealth that many white families possess, which also will impact their ability to afford health care. This wealth disparity is particularly problematic in Mississippi, where the federal poverty line for Black populations is much higher than the national average. These communities are disproportionately affected by chronic diseases as well, being diabetes, hypertension, asthma, and many more, which also require consistent care and management that many simply cannot afford without having Medicaid as insurance. The intersection of race and healthcare access is a critical issue in Mississippi. People of color in the state face compounded barriers not only due to socioeconomic status, but also due to systemic racism, which is embedded in the healthcare system. Studies indicate that minority populations often experience racial profiling, lack of cultural competence among healthcare professionals, and discriminatory practices within the medical settings. These factors create significant barriers to care for marginalized groups. In addition, racial minorities in Mississippi are more likely to live in areas with limited healthcare infrastructure. Geographic isolation within rural communities means that even those with some form of insurance, even the better insurances, may struggle to find care providers as the facilities are sparse and long travel distances can deter people from seeking timely treatment and getting life-saving measures. Without Medicaid, these individuals are left to navigate an already strained healthcare system where they're even treated as individual. The decision to expand Medicaid in Mississippi could significantly improve healthcare access, particularly for low-income individuals within these rural areas in Mississippi. According to the Kaiser Family Foundation, Medicaid expansion would reduce the healthcare coverage gap and provide much-needed relief to thousands of low-income residents, many of whom are people of color. With expanded Medicaid, these individuals would no longer have to choose between the necessities in life and picking healthcare. Expanding Medicaid would also improve health equity. For rural communities, this would mean better access to preventative care, management of chronic conditions previously mentioned, and a decrease in preventable hospitalizations and complications. This is especially critical in Mississippi, where the residents in rural areas already experience worse health outcomes compared to their urban counterparts due to a lack of access to care. The intersection of socioeconomic status, race, and healthcare access in Mississippi paints a picture of inequality and missed opportunity. Medicaid expansion presents a solution to these challenges by providing coverage to low-income populations, especially those in the rural and marginalized communities. By expanding Medicaid, Mississippi has the opportunity to reduce health disparities, improve health outcomes, and ensure that all residents, regardless of race or income, have access to the necessary care.